Okay. Hello from the National Rural Health Conference in Dunedin 2016, and I'm here with Di Wyatt from the Australian College of Rural and Remote Medicine. And welcome, Di. Thank you very much for making the effort to come over all the way over from Australia.
My pleasure, Joe.
To talk to us about the upcoming WONCA World Rural Health Conference that ACRM and others are hosting in 2017. So tell us about the conference.
Right, well, we're very excited because the last time we hosted a WONCA Rural Conference was way back in 2002.
Yeah.
So we thought it was time it came to Australasia, and so that we are hoping to work with you in New Zealand at providing a good look at rural health in both our countries. So Wyatt's been held in Cairns, beautiful, beautiful Cairns.
Yes.
At a wonderful time of the year for the tropics. We're also hoping that you'll be inviting people to come and spend some time with you doing a post-conference tour here as well.
Yes, we're looking forward to that. We're in the infancy of sort of organising it, but yes, we were definitely holding our post-conference tour in New Zealand to follow on from the conference. So tell us about the themes of the conference.
Right.
There's environment and leadership.
Yes.
There's people. There's an opportunity to share our stories.
Yes.
What things in particular might sort of draw New Zealand health providers to Cairns for this conference?
Right. Okay. I think there's a couple of opportunities here for New Zealand. One is around the fact that the conference is actually going to be held in conjunction with the National Rural Health Alliance conference, which is the 14th, which is an interdisciplinary conference of about 1,000 people.
Yeah. And
certainly that is one that will be inviting for your health work, for the rural health workforce of New Zealand.
Yeah.
It's also going to be coupled with the third summit on rural generalist medicine.
Fantastic.
Which is very critically important. There is an international working group that it's taken the results of both the first and the second summits.
Yes. And
they'll be working to present for the third summit, and hopefully that summit will in actual fact finalise a statement that we will then work with the World Organisation to try to move to acceptance at a policy level. So we're really looking at it going to the World Health Assembly. Yeah. So that again is something that is near and dear to New Zealanders, the scope of practice that is available to you, etc. So that again opens an opportunity for you to contribute to that international debate, as well as showcasing models of care in New Zealand. There will be an opportunity for scope for papers, posters, plenaries, etc. And yes, with the themes, we're trying to make the themes reasonably broad. And so we can address and look at issues that are of significance to the world at this time.
Yep. For
instance, I think we're all very, very conscious of what's happening with the refugees across the world and the effects. And those effects are not only in Europe and on the healthcare systems in Europe, but the refugees are being resettled in our own communities.
Yes.
And so, we have an opportunity to look at how rural doctors can help and support the environment, an international environment, and perhaps even impact on international thinking around those sorts of things that are happening. They're dramatic things that are happening worldwide, and they're not isolated from you as a rural doctor.
Thank you so much for that. I know it's a great opportunity for those high-level thinking and being able to influence international policy and international thinking.
That's right.
The WONCA conferences are the World Organisation of National Colleges and Academic Associations. Very influential at that level. But how many delegates are you expecting or hoping to have come to Cairns?
Well, we're hoping about 1,000 because we have at our conference at ACRM's conference, the Australian College of Rural and Remote Medicine, we normally have about 700 to 1,000. At the summits, we've had about 250 people, and the National Rural Health Alliance has about 1,000.
Yeah.
So we're hopeful that we'll maintain those sorts of figures.
1,000 plus, hopefully.
1,000 plus, hopefully. and from across the world. We have very good attendances from other countries.
Every Australian conference that I've been to has been dynamic and exciting and full of really interesting presenters who present in a really interesting way. I know that part of the theme is going to be around the practicalities of rural medicine as well. There'll be definitely lots of opportunity for continuing medical education, and also there's a bit of an interprofessional focus with the involvement of the National Rural Health Alliance as well.
It certainly is. It certainly is, and a lot of it, because education for rural, as we've seen at this conference, is very much about interdisciplinary and having the rural health team out there. And so that will be reflected through it. One model doesn't suit all countries, but when you're looking at multidisciplinary or interdisciplinary models of care, it's broadly used around the world. You know, some systems can't operate without that sort of agreement. So we hope to bring that in. And we want to see leadership on certain issues that are relevant internationally, Indigenous being one. And we've got a small group who's already starting to work on a paper being headed by Michael Zhong from Canada. He's pulling together a number of people working in mental health in Indigenous communities to hopefully have a workshop on some research and etc. that they will be doing prior to the conference. So we're already working with groups to enable participation and for them to be able to get it. So we're also inviting people, if they've got ideas or things they particularly want to do, let us know. You know, let us know what's important to them.
So tell us a couple of things about Cairns itself and why we should come.
Cairns is beautiful. That's why you should come. As you know, it's tropical. It's also where two of the natural wonders of the world meet. It's the only place on earth where and that's the Daintree and the Great Barrier Reef. So it's spectacularly beautiful. There's a lot of opportunities to go out onto the reef or up to the Daintree. It's magnificent sort of country. The facilities, one of the reasons we're going to Cairns is the facilities. They have an absolutely world-class conference centre. We held the first summit on rural generalist medicine there, and people were blown away at
lovely hotels, beautiful surrounding, and there'll be plenty of opportunity during the conference, not just for networking, but also to explore a little bit of the area as well.
That's exactly right.
So
that's
fantastic.
Exactly right. And
looking forward to it, Di.
So are we. There are opportunities to do some pre and post conference tours around the area as well. So we'd suggest people leave a little bit of time that they can do a bit of relaxation around all their hard work, because some will be working very, very hard at the conference. But I strongly recommend you come. It's going to be hopefully many, many countries represented and many disciplines represented.
Thank you very much, Di Wyatt from the Australian College of Rural and Remote Medicine. So look out on the website for the Wonka World Conference in Cairns.
That's right.
And we'll hope to see everybody there.